Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. It's April 1st, and I'm here today at the Guiding Light Mission in downtown Grand Rapids. And I want to say thank you to the great folks at Guiding Light Mission, and thank you most of all to our awesome team at the Kent County Health Department who have worked so hard to make this happen over the past couple of weeks. Now, what is this? So, as you know, we have many people in our community who struggle with homelessness. And some of them are going to become sick with coronavirus. And it's very important that we have a place for those people who are diagnosed with a positive COVID-19 to come to receive care and to be isolated from the rest of the community. That's what we have here. And so again, thank you to the good folks at Guiding Light Mission, and thank you to our team who's worked so hard to make this happen. Also, thank you to great organizations like Meijer and Amway who've donated so many goods that are going to help us take care of these people while they're recovering. It's very much appreciated and is going to really help our community. I also want to say, though, that this capacity is pretty slim. We can't care for an unlimited number of people here, just like our hospitals can't care for an unlimited number of people in their hospitals as well. And that's why it's so important that all of us continue to heed the advice to stay home and to avoid going out unnecessarily into the community. I spoke to our epidemiologist earlier today, and they're telling me that in many of the cases that they're investigating, people who are already showing symptoms either decided to go to work or decided to go out into the community when they really shouldn't have. It's really critically important right now that all of us eliminate unnecessary, unessential trips outside of the home. And if you're sick with a fever and coughing especially, but really if you're sick at all, avoid going out. Stay home. We need to stay home so that we can protect people and we can minimize the burden on places like this that are so slim in their capacity to care right now. So quickly I want to go over the numbers. Here in Kent County, we're now up to 118 positive COVID-19 cases. Sadly, we learned about a second death this morning. This was a woman in her 80s. And so our hearts and our thoughts and our prayers go out to that family. We know that this is going to be unavoidable in the coming days. We're going to hear more deaths like this. And just please know that it affects all of us personally. At the Kent County Health Department, we really do take this personal, and we really do want to make sure that as many people as possible get through this unharmed. Statewide, the last report has us at 7,615 cases with 259 deaths. In the U.S., we're now over 163,000 cases with about 3,000 deaths. Now, I've heard a question expressed in a number of arenas and over the media and in the community. Why is the U.S. struggling so badly with this? Why are our numbers of cases here in the U.S. greater than any other country in the world right now? And I want to assure you that, yes, we have a huge problem in the U.S., but we're not alone in this. This truly is an international problem right now. And to give you some perspective, when we look at death rates, keeping in mind it's very difficult to compare one country to another because the populations vary so much, we really have to look at rates. And so when we look at the rate of deaths per million of population, here in the U.S. we're currently at 12.32. That's 12.32 deaths per every million of population. That's far from the worst in the world right now. Spain and Italy have the highest death rates right now. In Spain, they're seeing a death rate of over 175 deaths per million of population. And in Italy, that's where the highest death rate is currently. They're at about 206 deaths per million of population. The U.S. is trending much more in the middle of the pack with countries like Sweden and Germany. In Sweden, their current death rate is about 18 deaths per million, and in Germany, it's about 9 deaths per million. I also want to point out that when you look at the map internationally, you'll see that the highest death rates and the highest case counts appear to be in Western countries, Western Europe and North America. And that's not because we're suffering any worse in those countries. It's in many cases because that's where the most modern healthcare and surveillance technology exists. Much of the rest of the world is suffering just the same as we are in the Western countries, but their surveillance systems are far less developed than ours are, and so we're not seeing the same level of monitoring. But rest assured, this is not a U.S. problem. This is an international problem, and it's something that we all have some control to limit, and that really comes down to you and I and everyone else in following those important public health messages. And most important, right now, social distancing. We can slow the spread of this, we can flatten that curve by social distancing and by staying home, avoiding those unnecessary trips into the community, and especially if you're sick, there's no reason why you should be leaving the house. So I just want to leave you with some encouragement. Stay positive, stay heroic, stay at home. That's what we need to do right now in order to slow this. Thanks a lot for watching today. Please continue to like and to share our Facebook updates. I'm Dr. Adam London from the Kent County Health Department. Thank you.